liver is a vital organ for human life. Chronic liver disease is a rising cause of morbidity and mortality worldwide. In Egypt, liver disease is the second common cause of death, representing more than 10% of total mortality. Among medical institutes managing liver disease in Egypt, Theodore Bilhart's Research Institute is best positioned to tackle liver disease research and management. Housing a 300-bed hospital and 20 multidisciplinary departments, TBRI is privileged for conducting integrated basic and applied research, clinical practices, and therapy evaluations. Globally, the grim outlook of liver disease is expected to aggravate with the rising tide of global ill health from liver disorders. This can only be reformed through concentrated efforts by the government, international health agencies, pharmaceutical industries, healthcare professionals, and public health experts. Within this perspective, the EU era-wide initiative in the frame of FP7 programme co-funded THEBERA Project, Theodore Bilhart's into the European research area, aiming to reinforce cooperative capacities of research centres located in the ENP countries to allow for coherent international health research schemes across the Mediterranean. In pursuing its objectives, THEBERA, with a view to raise national awareness regarding liver disease, published informative booklets targeting different stakeholders, for example patients and NGOs. The horizontal capacity building of TBRI's researchers was attained through study visits to well-developed, reputed European research centres, enhancing the participation in relevant liver research events, the organisation of 3 national workshops, strengthening networking to promote synergy with national and European research centres.
Truly, with respect to THEBERA, I became more acquainted with the EU framework, programs and procedures. Also, I learned how to compose concept notes. I learned more about the IPR issues and the ethical guidelines related to the medical research.
This helped in leveraging the visibility of TBRI and in opening up new channels of cooperation. The outcome of monitoring, review and analysis of the national state of art regarding liver diseases well acquaints policymakers and other relevant bodies with gaps and the concise input of priority needs in liver research that were found to span over 6 main pillars.
SWOT analysis performed under THEBERA project give us an idea about the potentials of our institute, as all the strengths, weaknesses and opportunities and threats were all availed.
A tailored 5-year strategic action plan to establish Theodore Bilhart's Research Institute as a competent centre in liver research, in addition to fostering strategic innovative R&D techniques in partnership with top European research centres, represent an important output of this project.
Indeed, the role played by the European Commission is indisputable. Working in THEBERA project enforced my belief and trust in the open innovation environment as a forward-looking concept, where we can share facilities, equipments, and expertise to keep our activities sustainable.
Open innovation environment presents a forward-looking concept, sharing resources in terms of expertise, facilities, equipment, as well as broadening links between the European community and the Mediterranean countries is bound to be productive.